Hello and welcome to this short presentation just explaining a recent report that we published via Health Education England named the F3 Phenomenon, Exploring a New Norm and Its Implications. My name is Dr Ruth Silverton and I'm one of the co-authors along with Professor Della Freeth from the Royal College of Physicians who helped to put this presentation together. Initially, I want to start by talking about why we did this report. So the interim NHS People Plan, when discussing the future medical workforce, stated that the hope was there will be a sustainable supply of doctors as a result of a sufficient flow of additional medical trainees and improved retention of doctors at all stages of medical training. Now, when we look at the trajectory of junior doctors taking time out post-foundation before they go into the training programme, we can see that in 2010, 83% progressed directly into specialty training after the foundation programme. By 2015, 52% were progressing directly into specialty training. And in 2019, which is the last year that we have figures from, only 35% of post-foundation doctors progressed directly into specialty training. And this raised some questions for us. Why are junior doctors choosing to take an F3 year? In retrospect, did that year provide them with what they hoped? And what are the implications for training systems and workforce planning? So for this presentation, what likely interests you as potential or current foundation doctors looking to do an F3 year, which is what we term the year following foundation if you're not in specialty training, is why are junior doctors choosing to do it? What reasons do they have and what are they getting out of it? So a little introduction to how we conducted the study before we go through the results. Initially, the hope was that we would travel to each foundation school and conduct some face-to-face semi-structured interviews and look at the different programmes that are on offer for F3 doctors. However, COVID-19 then hit and there was no travel to anywhere. So the study was conducted via my office in my house, and we recruited participants through Twitter and SurveyMonkey and a study landing page that we put on the Royal College of Physicians website. So what did we find having conducted these semi-structured interviews and gaining anonymous survey data from both pre-Foundation Year 3 doctors, current Foundation Year 3 doctors and past Foundation Year 3 doctors? Well, we found that the overarching theme was a break. People were taking a break from certain things, a break because of certain things, and a break for certain things. A break from included a break from training. So the challenges and toils of difficult rotas, difficult shift patterns, and the emotional and physical strain of clinical work, and a break from service. Within these two was also a break from portfolio requirements, ARCP and workforce-placed assessments. A number of people were also taking a break because of specialty uncertainty. You're not far through your Foundation Year 2 when applications for specialty training open, and many people haven't yet undertaken the specialty they think they might want to go into. There were people looking to take a break because of burnout. Either the fact that they were currently suffering with burnout or that they sensed they would do if they carried on working through a full-time training programme. There were many people taking a break because they were not yet ready. They felt that clinically they didn't have the experience yet to undertake a more senior role and they wanted a little bit more time and clinical exposure. There were a small number of respondents that took a break because they didn't get offered a post despite application. And overarching all of this was the fact that they could take a break because it was a natural time. The foundation programme is a distinct 2-year entity and the specialty training programmes continue following on from that. So there was a natural break in time. We also found that lots of people were taking a break for certain reasons. So one of the commonest factors was a break for autonomy. People wanting control over where they were working, when they were working, and what specialty they were working in. Within that was the idea of flexibility, that they could work for certain parts of the year and not for others. As a sort of continuation on the theme of burnout, there were many people taking a break for headspace. They felt that they just needed some time to gain a little bit of perspective, both from a career standpoint and a personal standpoint. Many people were taking a break for different opportunities. So professionally, that may be fellowships or specific jobs that aren't available within training. So expedition medicine, careers in healthcare abroad, helicopter and emergency medical services were some of the examples that were given. There's also opportunity to travel outside of clinical medicine and for personal reasons that may require additional time away from work. Some respondents were looking for a break for CV expansion, perhaps those that knew which specialty that they wanted to go into, but if competition rates were particularly high, they felt that an additional 12 months within that specialty would boost their CV and their application. And for some, they took a break for financial reasons, either to earn a similar salary for working less hours or to increase the amount of remuneration for clinical work through locum posts. So you can see from this slide that there was enormous breadth in the reasons why junior doctors were taking this F3 year. There was also the influence of others, and we found this a surprising and strong theme. So there were the influence of peers, those going through medical school and the foundation programme in a cohort talking about their F3, what they would do, how they would perhaps undertake jobs and travels together, and a sense of real camaraderie within that normalised the process of taking this year. There was the influence of near peers, so perhaps foundation year 3 doctors that they saw on the ward talking about their own experiences, or registrars discussing a break that they had taken or a break that they perhaps wished they had. There was the influence of seniors, so consultant level doctors giving advice in terms of there being no rush to enter or finish specialty training, and for some offering caution depending on which specialty they hope to apply for. There was the influence of others, so the influence of family members, either through personal requirements and needs for a junior doctor's time outside of clinical medicine, or supporting the idea of exploring other options, either educationally or clinically outside of specialty training. And then there was the influence of external discourse. So particularly mentioned was that the GMC allows for up to 3 years post-foundation for those foundation competencies to still count as you apply to specialty training. And also the number of jobs directed towards this post-foundation year on the NHS Jobs website, be that advertised as an F3 post, a trust grade post, or a clinical fellow post. There was the idea that this year and this entity was in existence. So one of the most important things that we took away from this study was the interconnectedness of all these factors. We did not have any respondents that had only one reason for taking an F3. There were a multitude of reasons for everybody, and they were very individual. They often covered something from a break from, something from a break because, and something from a break for, alongside some of those external influences that we always talked about. So what we mention in the report is this idea that just adding individual solutions to try and move people from the foundation programme straight to specialty training may not be effective, and actually acknowledging that everybody is an individual in making these choices and that they are made for personal and professional reasons is really important. So what to you as a foundation doctor or medical student, or perhaps someone in that year post-foundation? Well, what's important for us to have taken away from this is A, that taking this year post-foundation may now be the new norm, and we want to be supportive in any way that we can. B, that the reasons are very individual and interconnected. And C, that it's really important that we ensure that you, the trust within which you work clinically, and the wider workforce are all getting everything they need from that year. So as such, we've put together another couple of videos for you to watch that talk about how to make the most out of this year if you're choosing to take it, and particularly what support mechanisms you might want to explore if you do go down the F3 route. Thank you very much for watching.